Okay, welcome everyone to the webinar for how national organizations can benefit from the Tech RRT, the ins and outs of the Tech RRT. I think we're going to go ahead and start as we do have quite a few people online, and I want to appreciate the fact that you've managed to get here in time. So thank you very much. My name is Andy Kendall. I'm the Tech RRT Program Manager, and I'm very much looking forward to today's webinar. It will be the first in a series. We will have it in other languages over the course of, let's say, the next month or so, although we haven't actually set the dates yet. So as soon as we have them, you'll see emails coming through in the same channels that you received this one. Before we start, I just want to make sure that everyone has put themselves on mute so that everyone can hear well the webinar. In the bottom right-hand corner of the screen, you'll see an icon that says audio on. If you click on that to mute yourself, that would be much appreciated. Otherwise, I'm just going to go through what will be in today's webinar. Also, if you've just joined, if you can introduce yourselves in the chat box, that would be great. Thank you. At the end of the webinar, we should have a few minutes for questions. So, but feel free to write questions in the chat box throughout the presentation. So for today's webinar, we're first going to talk about why is the Tech RRT relevant for national organizations. We're going to go through what is the Tech RRT, what has the Tech RRT done to date, what support can be provided through the Tech RRT, and how to request the Tech RRT, including considerations and requirements for making a request. Finally, we'll talk also about how much Tech RRT support costs. So for national organizations, I think the first thing to talk about is what do we mean when we say national organizations? I think some people automatically think that we're talking about national and local NGOs. This is true, but in fact it's broader than that. National organizations includes national governmental bodies and departments. Okay, so this is something that's very important as we go through. When we're looking to support, we're not just looking at national and local NGOs, we're looking at much broader than that. There are quite a few synergies between the Tech RRT and national organizations. Two key ones is that both are invested to improve the situation for people living in and affected by humanitarian contexts. And it's there's a synergy that marries field level programming, meaning hands-on people reaching people affected by humanitarian emergencies immediately with technical capacities. Now, just to go into what the Tech RRT is. The Tech RRT actually, so Tech RRT, it stands for Technical Rapid Response Team. We specifically are working within the nutrition sector, but we do touch upon other sectors with our support. We are a technical rapid response mechanism, and we rapidly deploy emergency nutrition advisors to support humanitarian nutrition emergencies. So it is a consortium led by International Medical Corps in partnership with Action Against Hunger and Save the Children. At the moment, we have funding from USAID. The department, so from OFDA. Currently, we have funding until the end of February of 2019. We work in close collaboration with the Global Nutrition Cluster and UNICEF. Our goal is to improve and strengthen the technical quality of programs and assessments for improved nutrition outcomes of affected populations in emergencies and in protracted crisis situations. It can be for the collective, that could mean it's through the nutrition cluster, nutrition coordination platform. That's been one of our mainstays since we started, but we've broadened our support to be able to support individual agencies or several agencies together that want to make a request for support. The idea is to improve the technical quality and/or scale and reach of programs. It's not about gap filling for human resource gaps, though. In general, so deployments on average last for 6 weeks. They can be shorter, they can be longer. It is possible to deploy advisors within 72 hours if it's relevant. An advisor's time is allocated 50% between field deployments and 50% remote support. Sorry, there's one thing I missed. The Tech RRT started in August of 2015. We recently completed sort of the first phase of our project, and we're coming into what we're calling the second phase of the project now, that continues through February. Okay, who are the Tech RRT? Okay. Before I continue, there's somebody who I think needs to put themselves on mute, as there's quite a lot of noise coming from somebody. If you look in the bottom right-hand side of the screen, there's a button that says audio on. If you can push that, that will mute yourself. I'm going to interrupt the presentation just a second to see if I can figure out who needs to put themselves on mute. Just a second. Okay. Okay. Somebody called Sobatafo Marley. I can't see the full name. If you can please put yourself on mute. In the bottom right-hand side of the screen, you'll see the audio on button. That's where you push to put yourself on mute. If you could do that, that would be great. Thank you. Okay. We've gone through this one. Just to bring back where we were. Okay, thank you very much. So the Tech RRT, we have a team of 3 deployable experts. They're in 3 different areas of expertise. We have 1 advisor in surveys and assessments. That's Scott Logue. He's actually on the call with us today. So later, if anybody has any specific questions for him, please do feel free. We have expert in community-based management of acute malnutrition, also known as CMAM. We also have advisors, in fact, 2 advisors who cover the area of infant and young child feeding and emergencies, also known as IYCF-E. We do have another advisor on the call today, Michelle Gergen, who is also available for questions later if you want to talk about a specific area of expertise. We do also have the ability to have some flexibility to find other profiles when it's needed. So for example, in the past, we've had a social behavior change advisor, and we can sometimes do deployments in that. The flexibility also allows us to fulfill requests in language, perhaps for an advisor that has a specific language requirement, for example, Arabic. We have a French speaker on the team, and then we have some other possibilities. So that helps to be able to fulfill a wider range of requests. We have a deployment steering committee. They review and endorse deployment requests, and they provide input into deployment terms of reference. The Deployment Steering Committee is made up of all the consortium partners, as well as UNICEF and the Global Nutrition Cluster. We also do include our donor, OFDA, in the revision of TORs, and they approve deployments, although there are some cases in general, if it's an L3 or L2 categorization emergency, if it's considered a humanitarian crisis according to ACAPS, countries with limited technical capacity in nutrition and emergencies, and that it does not duplicate other support on the ground. This is very important because we really have a resource that is sought after, and we have to make sure that it's used as best as possible. So if there's another avenue that either has plans to deploy or could deploy, we discuss it with them as well to make sure that we don't duplicate what's happening. Our priority criteria are if there's a declaration of a level 3 emergency, It's a rapid onset emergency or rapid deterioration of a pre-existing situation, or a threat or forecast of an L2, L3 emergency. Review by the Deployment Steering Committee is done, and we give a response within 72 hours, at least to let you know exactly where we are in the process, if it's going to be possible for deployment or not, or if there's more information that's required to work through to make a decision. What has the Tech RRT done to date? In fact, you'll see the map. These are the locations where we've had deployments. We've had 41 deployments since August of 2015 to 15 different countries. 7 of those 41 deployments have been done with other funding sources other than OFDA. If you'd like to understand a bit about the breakdown of deployments, the majority of our deployments have been for infant and young child feeding and emergencies, with about a third of the deployments, followed by CMAM, and we've had the least for assessments and for social behavior change. So what can be done on deployments? So the possible support to countries and organizations. This is probably what you're most interested in. Just a second. Okay, sorry. There we go. So those are our 3 areas of expertise, as we've already discussed. Now you'll see here, this is possible. These are possibilities for any technical area. So this is just generally. It's possible for advisors to work to assess capacity building needs, to facilitate trainings and training of trainers, orientation sessions, to support or lead assessments, to monitor programs with supportive supervision visits, and this is always followed by recommendations, and as long as there's time after the visits, to support the organizations to take action. The advisors can also help others to learn how to do this. That we can talk about a bit more on something that we've been working on with coaching training. The advisors can also assist with integrating programs within nutrition itself, as well as with other sectors' programs. Also, be able to provide input and support to develop proposals and budgets. Okay, this is more focused for national organizations, not so much for cluster support. If it's required, we can, but there's usually other resources that can do that. So now specifically looking at surveys and assessments, the possibilities for the advisor. He can lead assessments or strengthen the capacity of others to lead. And that's starting from planning all the way through till the report is written, including recommendations, etc., presentation at the end, everything. He can provide support for different types of assessments, initial rapid assessments, IYCF assessments, SENS methodology or CAP, anemia assessments, barrier analysis. Up till now, there's been a lot of focus on SMART surveys, but now we're trying to link more with the SMART team for them to provide that support at a national level, and we still can provide this support for SMART surveys at a subnational level or for individual organizations. Some previous deployments have been to Iraq, to Yemen, to Ethiopia. 2 of those were for SMART surveys. The one to Yemen was more about developing national guidelines for conducting surveys and working with the assessment working group to help them to be able to have the capacity to review protocols and validate results of surveys. For CMAM, again, this is very similar to what I said all can do. Lead assessments to decide on startup or scale up of CMAM programs, to assess the capacity building needs. It could be generally for CMAM or for specific components. For example, maybe specifically around the less than 6-month-olds, or it could be specific to inpatient care. It really depends on the needs. They can facilitate trainings, etc., monitoring supervision, supportive supervision visits, and input into proposals and budgets. I won't spend more time on that because we've talked about it a little bit. Some recent deployments for CMAM have been to DRC, to Ethiopia, and Nigeria. In DRC, the advisor was working with the cluster on quality assurance framework in the Kasai region, also training on inpatient management of SAM with complications. In Ethiopia and Nigeria, there was a process that started with a capacity gap assessment, and then that led into workshops to be able to address the gaps to improve programming. Then it was followed up by coaching training, whereby CMAM supervisors were supported on how to do on-the-job training and with looking specifically at the weaknesses that were seen in their programs. Finally, for IYCF, again, they can assess the capacity building needs, facilitate trainings, support with monitoring, supportive supervision visits to establish recommendations for action, integration of IYCF-E into nutrition activities. This is something that can be weak in lots of countries, so this is something that's really needed, and particularly with other sectors programming. Some key themes that are worked on within IYCF-E is breastfeeding assessments and relactation, breast milk substitute programming. This includes the Code of Marketing and Management of Confiscated BMS. Looking at behavior change communication initiatives like one-to-one counseling and support groups, making sure that we're not just doing one-way communication, but having opportunities for women, new mothers, and pregnant women to be able to feed back on how it's going for them and to be able to help them, making sure that programs include this two-way communication. Some recent deployments are to DRC, to Uganda, to South Sudan, with a really wide range of activities. In DRC, it focused on developing an action plan and working through 3 levels of training, a training of trainers, followed by the cascade training by those people, and then another cascade training down to the community health workers. In Uganda, with the refugees that have been coming in from DRC, there was a very quick deployment to review the reception sites, the transit sites, refugee settlements, to see how to integrate IYCF-E into the multi-sectoral programming. This had a specific focus on WFP platforms to take up the opportunity of the contact point and to make sure that these distribution sites were providing the best opportunity to promote and protect breastfeeding for women and children. In South Sudan, there was support for master trainers and the rollout of the training of trainers for a training package. And this was followed up by actually monitoring visits of the places that had been trained before to see if they were really implementing and how could they integrate the training they had received better. Okay. I mentioned earlier on that the advisors spend 50% of their time on remote support, whether home-based. This means that they can do lots of different things during that time. We have generally 3 categories of activities that they work on. They work on global level initiatives, for example, a revision of the CMAM toolkit and the IFE operational guidance that's recently come out. They also do a lot of work linked with previous deployments, so follow-up supports to countries, for example, in Yemen. After Scott worked with the assessment working group, he continued to support them for some time in their review and validation of survey protocols and results, etc. So things that are linked with previous deployments is a possibility for non-deployment time. There's also other country level support that's not linked to deployments. So sometimes we have specific requests from a country. For example, in Puerto Rico, when the hurricane hit, our advisor was able to guide local actors on which activities to prioritize for IYCF-E immediately following the hurricane, and provided many tools for their use and guidance, for example, on cold water sterilization of feeding utensils without having any power. These are, as I said, just examples, but really if there is a need for remote support, this is something we can entertain, and feel free to reach out. Okay, so how to request support. This gets more into the nuts and bolts of how you can access the Tech RRT. So who can request? Basically anyone. If you're in a country and you see on the ground that there's a need for technical support, reach out. And it can be an individual organization, or it can be just an individual. It can be the nutrition cluster sector group, anyone really. But how to do it? you contact the Tech RRT, or you can contact the GNC if you prefer. If you don't remember exactly how to contact us, you can do it via email. You can use the Tech RRT website. There's a request button on there. Feel free to do it that way. You can send a Skype or a WhatsApp to me. At the end, I share all of my details with you, although I think you have most of them from the emails. There's a request form that's on the website. We also have one that I can share by email, and that has to be filled in, and then a TOR has to be developed. This is what outlines exactly what will the advisor do when they get on the ground. We do have generic templates that we can share within the 3 different technical areas that can help you to say, to focus what do you want to do. You can take this TOR and you edit it and adapt it as you need for the specific country context. Okay, some other considerations when making requests. So there's who should do the requests. The important thing, really anybody can do the request, but it's important to know that the head of the agency has to sign it. So it has to be talked about within your own agency. And it shouldn't be a gap in HR, as I mentioned before, but a gap in technical capacity. The next main consideration is hosting. This is important because when the advisor arrives to the country, who are they going to stay with? Who's going to take them around? Are they going to be with a specific organization, but who's going to look after them? Wait, sorry about that. One of the most important considerations for this one is about security arrangements. So we tend, if it's possible, then it's easy for one of the consortium partners to host the advisor when they arrive on the ground. This can be a little bit easier for security arrangements reasons because they're already come under their mandate. But it's something that we have to work out for each deployment specifically. Also, the hosting agency should be in charge of all this logistical and administrative support. So that means if there's going to be a training, that organization or a group of organizations works towards preparing that training, but that it also makes sure that all the arrangements are in place for the advisor to be where they need to be for that training. Okay, the other important consideration for deployment is who is the in-country supervisor. There are lots of different things that the in-country supervisor has to do. There's the pre-deployment time, when they plan and prepare for the work to take place on arrival. As you already have heard, deployments are not very long. The TORs have to be well focused. And so that means when the advisor arrives on the ground, we need to make sure the advisor can hit the ground running. That means that if there's going to be a training, that it's thought about when is it going to be, who's going to attend, do we have everything in place for it, do we have the budget for the activities that the advisor is going to do, are all the people involved, are they aware, all the people that are involved, are they aware of what's going to take place and what they're going to need to be involved in. These are some key points to make sure that it's a successful deployment, because when there's a delay, it basically means that the advisor can't do as much as they were intended to do if they're not able to hit the ground running. During the deployment itself, the in-country supervisor technically supports and oversees the work of the advisor. In general, that's making sure at the very beginning that the advisor gets introduced properly to all the people that they need to work with, that they have access to everyone that they need to work with, and that if for example there's going to be a training and that's for several organizations, but there needs to be communication with the Ministry of Health first about it, that communication takes place and the in-country supervisor is part of making sure that these things happen. Most of the bulk of the additional work, let's say, is on wrap up of the deployment. It's not too heavy, but it's important. There's a debriefing that has to take place with the advisor. There's a performance evaluation form, which doesn't take too long, and then there's a support in country to a final presentation if it's going to take place, which usually it does. Finally, in the post-deployment period, so after the advisor leaves, then there are a few things that we ask. One is that a satisfaction survey is filled out, and in fact that's shared with many people who the key people who are involved in the deployment. There's also the possibility of a post-deployment webinar. You may have seen announcements, you may have even joined some of those before. We do this for information sharing and for better follow-up after deployments. And that brings us into the last point, which is to take forward the work that's been started. This is critical because otherwise the work that the advisor does, we don't want it to sit on a shelf. We don't want it to sit in, if it's a training, that only the people trained have that knowledge and it doesn't go elsewhere. The idea is to make sure that the response is improved because of the work that the advisor does with the organization. So this is something we're trying to focus a bit more on. Okay, the big question, how much does it cost? Well, this depends on the resources available in country. In the past, we've been able, OFDA has been very generous at the beginning. For the first 2 years of our project, we were able to they were able to completely fund deployments. But we've been looking more towards sustainability, and therefore now we've had to develop different tiers of contribution possibilities. That means that it's possible for a deployment to have no cost. But if it's possible for a country or organization to contribute, then we try. This makes it so that the resources we have can go further to help more countries. So we have different tiers. So tier 1A, that's where the country or organization pays just for the travel costs of the advisor. That includes flights, accommodation, per diem, visas, things like that. The next possibility is 1B, where the country or organization pays just for the advisor salary or fees costs. Then the next possibility is tier 2. That's when the country or organization pays for both travel costs and the advisor salary costs. So this is the full cost of a deployment. Then finally, the third tier includes the same as tier 2 plus program support costs. So this is really what it costs to run the Tech RRT project. So each deployment takes a small piece of what it costs to run everything. So when we receive an inquiry or a request, we discuss it with the country and the organization, looking at the specific context and the deployment requirements to see how much it's going to cost, and then to see if the country or organization can contribute. Finally, if costs can be covered, that means, as I mentioned a few minutes ago, others without means can be supported. That means the money that we do have from OFDA can go just a little bit further. So currently, obviously, this is called cost sharing, cost recovery. Obviously, this makes it a little bit more administratively heavy, but we're currently working on ways to make this easier. So don't be scared about this. Okay, I think that's it from my side. I'm hoping you have lots of questions, and we do have about 20 minutes for questions. So I want to thank you, and I want to share all the contact details with you, although you all already have been in email contact with us, so you already have some idea how to reach us. But as well, if we've recently started our Twitter account, and we'd love to have others to join us, so feel free to follow us on Twitter. Now, Michelle and Scott, as I mentioned, they're both on the line, two of our advisors. So if you have any questions specific to them, feel free. And then otherwise, I'm not sure if there are already some questions in the chat menu. Michelle?
There are not already questions, just one about making the slides available. I said we'd email them out and post them on our website. And if anyone else has any questions, feel free to type them in the chat box or ask verbally.
Hi, Michelle and Andy. This is Ando.
Hello.
Hello, this is Ando from World Vision. Can you hear me?
Yes, I can hear you very well. Go ahead.
Great. Thank you very much for the for the presentation and for the opportunity. I've actually seen this webinar through other people, so I'm not in your contact, but I'm really interested in the possibility to use a technical RRT. My question is, do we as World Vision International, are we allowed to request for your technical support as an international organization?
Very good question. Absolutely. There's nobody who is exempt from being able to request our support. Actually, that's not entirely true. We don't support if it's a for-profit organization, but absolutely international organizations are able to request. The webinar today was more focused towards national organizations because we've had more trouble reaching national organizations, but absolutely feel free to send a request.
Okay, now I have your contact, so yeah, it's not for CAPS, technical advisory, right?
Sorry, I didn't hear you. I think somebody else has their.
Yeah, so I understood it's not for CAPS in human resources, but for technical advisory roles.
Exactly.
Excellent.
You've
Thank
understood
you.
well. Thank you.
Okay, thanks.
Anybody else have any questions?
Hello.
Hello. Please go
Hello.
ahead. Yeah.
Okay.
Hello.
Thanks for the presentation. Hello, can you hear me?
Yes. Can you just mention who it is?
Okay.
Because introduce yourself first.
Okay. Okay. So this is Adia Oros from Paris, Nigeria.
Great. Thank you. Please
Okay.
go ahead.
So I'm kind of interested in knowing your work as regards nutrition, making use of locally available food in emergencies. Have you done anything in relation to using locally available foods for emergency programming that will have to do with treating cases, maybe MAM cases or maybe some cases? So.
Hang on just one second. Just to make sure that I understood your question correctly. You're asking if we have done any work with using locally available foods for nutrition programming. Is that right?
Yes. Have you given any advice on how we can make use of locally available food for nutrition programming?
Okay. As far as I understand, and I'm going to pass the question a little bit over to Michelle, but as far as I understand up to date, we have not, but it doesn't mean that we cannot. We can, for sure. If there are specific needs for that, we can surely build it into a TOR and something we can look into. Sure.
Okay.
Michelle, do you in any of your deployments have you had any interaction with locally available foods?
So we haven't done anything where we use locally available foods for treatment of MAM or SAM, but I know that there are a lot of protocols that have recipes and ways to do this, so it's definitely something we could facilitate if there's a need. So if that's the need, definitely feel free to request from the TOR.
Okay. So so maybe we can have the discussion offline as regards this. Thanks.
Okay. And then Andy, there's a couple more questions in the chat room.
Hello?
Okay, great.
One of them is, what context does the Tech RRT operate?
Okay. Okay. Just to clarify the question, I'm not exactly clear what you mean. We operate in emergency contexts. It really could be anywhere. We operate less in situations that are not considered humanitarian because it can't be funded by OFTA. If it can be funded by another source, then we can look at the possibility. Maybe could you, I'm not sure if I've answered the question. Is there any more, can somebody be a little bit more specific? Michelle, who asked the question?
Yeah, it was Mutegi. Mutegi, does that answer the question? Yes, he said yes.
Okay,
and then
great.
there's also one more in the chat box, and it says, are there lessons learned from our engagement and technical support provision at global and national level?
Oof. Yes, in fact, there's quite a lot of lessons learned. Lots we've had about. We're coming on our 3-year anniversary at the end of this month. At the end of our last project, we had an evaluation, an external evaluation that was carried out. That was in February and March of this year. I'm happy to share the reports. In general, it was found that the support that we provided was timely and effective and efficient, and that advisors were able to fulfill the TORs that were shared with us. There were lots of findings, so it's difficult to highlight everything. But we also, I mentioned during the call about user satisfaction surveys and performance evaluation forms. We also have collated all the information from those, and we have results that have come out of those as well. Don't have them in a report for sharing externally, but I will be I have a final report that I shared with OFDA, and if somebody's interested to see any of those, I'm more than happy to pull out the contents that are appropriate that I can share and share that. I'm more than happy.
Please share if
Hello?
you do have them.
Okay, great.
Hello? Hello?
Hello.
Hello? Yes, this is Soptafu.
Welcome. Thank
Hello?
you. Go
Yes,
ahead. We can hear you.
thank you. Thank you very much. Yes, thank you very much for your brilliant and very clear presentation. And I have just one question about the presentation. Of course, I joined a bit late because I had difficulties downloading the blue jeans. It was my first time to come into contact with it. But I would like to know whether you have a global strategy for your interventions, or you adapt your interventions according to each country with its realities. Because as we know, each country is not like any other. It has its own realities, its own culture, and so on. So, do you have this flexibility for your interventions?
It's a good question. Thank you very much for that. In fact, because we deploy based on a request and a terms of reference that the country develops, so the country or the organization. So for example, if your organization decided it needed technical support and wanted to ask the Tech RRT, you would tell us and you would develop a terms of reference with exactly what you wanted the Tech RRT to do. So we would do only what you would ask. The project in general has overall global objectives and global strategy, but the specific deployments are focused on a specific country and a specific context. So everything that the Tech RRT advisors do in country is for that country only, or for that organization. In fact, if it's specific to an individual agency. Does that make sense?
Okay, thank you very much. Oh, yeah, yes,
Great.
It makes sense to me. Yes, thank you very much for that. Is it possible to have the presentation after? Yes, the PowerPoint at the end of the presentation?
Yes, we will share it.
Fine. Thank you very much.
Thank you. Are there any other questions? Okay, no more questions in the chat box, Michelle?
Yes, actually, just one more came in.
Hello.
Okay. Yep.
Hello. Can you hear me? Can you hear me?
We can.
Yeah. Oh, okay. Okay. Thank you.
Who is this?
Ikram Hassan from
Okay.
Yemen, Nutrition Field Officer from
Great.
ICRC.
Fantastic.
Okay,
Welcome.
Thank you so much.
Okay. Do you have a question for us?
No.
Okay. Great.
Okay, there's just one more question in the chat box, Andy.
Okay.
It's the capacity building you do. Is it mainly government personnel? If so, is there other support given on an ongoing basis?
Okay, that's a good question. Yes and no. No, but well, let me go into details. The capacity building we do depends on the specific TOR. So if the country or the organization that's requesting us has asked for support to build the capacity of government staff, then that's what we will do. But in general, up till now, we try to make sure that trainings involve as many different actors as possible, so that the work can have a greater reach. So quite often it involves the government, as well as international NGOs and national NGOs, UN agencies. So in most cases, all are involved if it's a training or capacity building activity. If it's an individual agency request, then it can be a training just for that agency staff if it's an NGO. If it's a government body that's asked for the request, it could be just government staff. But it depends on the needs of the specific country. Sorry, can you repeat what the second half of the question was?
Is there other support given on an ongoing basis?
Okay.
Okay.
Okay. As the Tech RRT deployment is very short in the grander scheme of things, that means that any training that takes place or capacity building initiative needs to be embedded in a bigger process, and there needs to be organizations or people that are in charge of that and leading that and moving that forward. We really stress that any capacity building initiatives are not just one-off trainings. We know that they're not efficient like that because they don't necessarily end up in having a change in programmatic activities or improvement in the quality of the work. We really emphasize that it's important to have follow-up after capacity building initiatives if it's a training, and that there is continuous monitoring and supportive supervision. This is where recently Michelle actually has been working a lot on a coaching training package to train program managers how to do better, more effective supportive supervision, and helping the managers as well as the health workers to better identify solutions to their own problems and be able to solve them during a monitoring visit, instead of always waiting for external support. Yeah, okay. I think that there's one other thing. At the moment, 3 advisors and myself, we're working on an article that we'll be publishing sometime soon on the Field Exchange or the ENN website, that's looking at how to improve efficiency, effectiveness of training and capacity building initiatives. So this is going to bring out a few key lessons that we've learned in capacity building. One of which is about making sure that it's embedded in a bigger process that includes support on the ground to roll out. But in general, we can say that a large percentage of the people that are the beneficiaries, let's say, of capacity strengthening work are national health workers. Are there any other questions?
Capacity you generally observe.
I missed the question. Say it again, please.
What is the biggest gap? What capacity you generally observe?
Hang on, you're breaking up a bit. What is the I'm sorry, I'm missing the question a little bit.
What is the biggest gap in technical capacity you generally observe?
This is a very difficult question, and I think it would depend on the specific technical areas. Perhaps I can let Michelle and Scott answer each for their own technical area.
Can you hear me now?
Yes, we can.
Okay. So one of the gaps because there actually is a lot of technical capacity in countries, but something I've seen in multiple countries are sort of gaps at follow-up after trainings. So a lot of organizations or governments will do a training and just kind of send everyone off to do the work without kind of follow-up in the context in which they're implementing what they've learned in the training. So whether it's CMAM or IYCF. And I think that's one of the things we're really doing with coaching and kind of supporting supervision efforts is to really make sure that after people are trained that there's almost a second component there to have either the trainers or someone else, some kind of supervisor from the government follow up on those who were trained to make sure they've understood and can apply all the concepts correctly. So that's one of the first ones that comes to mind for me. I don't know if Scott, do you have any?
I think it just varies so much from country to country, or perhaps even different regions. I think similar to that, in some areas it's basically brain drain. Some people have been trained in assessments, and then they'll leave an area, and then it doesn't get knowledge doesn't get passed to other people. So when employees leave, knowledge doesn't transfer. That's a big one. There are a couple other big ones. Probably representative, maintaining representative sampling. That's a lot of times not having capacity to be able to have the skills to maintain a representative sample in both phases of the survey, a cluster survey. That's a pretty big one.
Great. Thank you for that, Scott. Michelle, did that answer the person's question, or did you want to follow up at all?
Hello?
Hello.
Hello? Yeah. Yes. Yes, I have a question. It's me sometime who I'm back.
Okay. Go ahead.
Yes. Yes, I'm a consultant. And yes, I just have following the previous one, and I was just asking whether you have ever considered having some technical advisor who are closer to the countries. What I mean is that maybe posting maybe one advisor for each region, so that whenever there is a need, the advisor can just quickly go there, can just be closer, this branch of countries. So I just wonder if this can make things more efficient or maybe it's not something that is you are going to be deployed anyway. Yeah.
Okay.
Thank you.
In fact, Michelle is based in Nairobi, Kenya. But in general, and Scott is based in Toronto. We have the third advisor for IYCF advisor. We have had somebody who was based in London part of the time. Then we had somebody who was based in the Philippines. Now, in fact, we've gone to a different mechanism, let's say, and so we have a pool of advisors from Save the Children that are based in lots of different locations. And the difficulty with having regionally based advisors is that each request is for a different technical area, and it's very difficult to get one person in each region who has all of the technical specialties to be able to deploy in that way. It's an interesting idea, and in fact we have a strategy session, Tech RRT strategy session coming up this Friday. So it's very timely, and it's an idea that I will bring to that meeting. Thank you.
So there's one more question in the chat room. Does the
Great.
funding allow for working in protracted crisis in development countries?
Okay. In protracted emergencies, absolutely. OFDA funding allows for that. In development countries, OFDA funding does not allow for that. But having said that, also OFDA funding does not allow for working in refugee contexts either. However, we have been able to find, through cost sharing, cost recovery mechanisms, we've been able to find ways to overcome the challenge of finding specific funding for specific requests. So for example, for Cox's Bazar, we were able, when we had numerous requests coming in for support, we were able to, through networking and some work, figure out how to make sure that we were able to respond to those crises through different donors, in fact. So so for a development context as well, if there's a request, we would be able to look into possibilities. It's always possible to have a deployment fully covered by the country or the organization. If that's not a possibility for the organization or the country, then we have some different means that we can access to see if we can get funding for the specific request. There's possibilities through SUN. There's also just discussing with some of the donors in the specific country, as well as we have some other new means that might be coming on board in the coming few months. To be able to respond in development contexts. But having said that, we are still looking to diversify our funding, our core funding base, to be able to know that we have funding to cover those sorts of requests. Does that answer the question all right? Are there any other questions? Okay, I take silence as that there are not, and in fact the time is perfect. Although we started a few minutes late, it's actually just past the hour, so it's a perfect time if there are no more questions to wrap up. And I wanted to thank everyone very, very much for the time and for joining us. If you'd like more information or you'd like to discuss a specific request or anything, please feel free to reach out. That's what we're here for. And otherwise, I will share with you the presentation, the external evaluation, and some other bits and pieces that were requested. And I hope that you've enjoyed the webinar. Many, many, many thanks.
Yeah, I did. Thank you.
Take care.
Yeah, thank you.
Oh. Okay, sorry, there's one other question that was mentioned if you're still on the line. Just to make it clear that the requesting and the hosting agency don't need to be the same organization. So if you're interested to request, but you don't think you can host, don't worry, we can work it out. So just contact us and we'll see what we can do. Thanks again.